Hello and welcome everyone. Myself Mijanur Rahaman and today my topic of discussion is sternum. Today we will discuss about the bone called sternum. So first of all, general characteristics. So all of us are known to that it is a flat bone and it is located in the median part of the anterior chest wall. So it is present in anterior chest wall and in the anterior chest wall it is present in the median part. Next, its length. How much is the length? The length is about 7 inches or 17 centimeter long. Now, it is mainly made up of spongy bone. So, it is rich in red bone marrow. So, it is made up of what? It is a spongy bone and it is rich in red bone marrow. And sternum has three parts. One is manubrium, second is body, and third is xiphoid process. Now, bony features. So in this part, this is known as jugular notch or suprascapular notch. Then these two are clavicular notch. And then here presence of sternal angle. And they are present notch for costal cartilage. There are total 7 costal cartilages. 7 costal cartilage notch. So what are the bony features? First of all, jugular notch. Second, clavicular notch. 2 in number. Then sternal angle or angle of Lewis. And then notch for first costal cartilage, second, third, fourth, fifth, sixth, and seventh. This first one and the half of the second present in Manubrium, and the half of seventh present in Xiphoid process, and the in between the half of second to half of seventh is present in body. So here is one and half, there is only half, and there is 1 2 3 4 4 total, half plus 4 plus half. So these are the bony features and general characteristics of sternum. Now we will discuss about the singular details. Now manubrium. As all of us know that manubrium, body and Xiphoid process, there are three parts. So first of all, manubrium. Manubrium is also known as pre-sternum. or episternum. And it is wider above and than the below. It is mainly broadly wider in the upper part. This is Manubrium. The upper part is more wider than the lower part. Now, it has two surfaces and four border. Two surfaces and four border. Surfaces are anterior and posterior, and borders are superior, inferior, and two lateral. So what are the borders? There are four borders and two surfaces. Those four borders are superior border, inferior border, this is superior border, inferior border, two lateral border. This surface is anterior and the behind one is posterior surface. So now we will come to know the attachment part. Anterior surface gives origin on either side to pectoralis major and sternal head of sternocleidomastoid. The pectoralis major is present like this in the both side, and the sternal head of the sternocleidomastoid muscle. So these are the attachment present on the anterior surface. So anterior surface has two muscle attachment. One is pectoralis major and the sternal head of the sternocleidomastoid. Now posterior surface. Posterior surface forms the anterior boundary of the superior mediastinum. Superior mediastinum. So what it makes? It forms the anterior boundary of the superior mediastinum, and it gives origin on either sides to sternohyoid and sternothyroid muscle. So what are the attachment of posterior surface? First of all, it gives origin to, and actually it forms the anterior boundary of superior mediastinum, and it gives origin on either sides to sternohyoid and sternothyroid. And each half of the lateral part of the posterior surface of the manubrium is related to corresponding parietal pleura. So what it is related with? As all of us know that behind the sternum there is presence of the inner part of the chest like lungs, heart. These are present in behind the sternum and the rib cage. So what are the content and what it related to it? Each half of the lateral part, okay, of the posterior surface of the manubrium is related to corresponding parietal pleura. And this surface is also related with vessels, like there are some vessels of the posterior surface, the related vessels. In the lower part, first, we all of us know that the arch of aorta is present at the level of the sternal angle, and in the lower part there is presence of the sternal angle. So in the lower part there will be arch of aorta, and in the upper part there is left brachiocephalic trunk, left brachiocephalic vein, sorry. Then second is brachiocephalic trunk, third is left common carotid artery, and fourth one is left subclavian artery. We have mentioned that left brachiocephalic vein, but why not the right brachiocephalic vein? Let's see here. If we take this as sternum, then here is the arch of aorta, and we all of know that it is left subclavian, it is left common carotid, and brachiocephalic trunk. These all are related. I have discussed. Now we are going to discuss that there is left brachiocephalic vein, but why the right one not? Here is coming left brachiocephalic vein, and this is right brachiocephalic vein. Then the left brachiocephalic vein is coming more distance from and coming more closer to the sternum, but the right brachiocephalic vein is quite posterior, but it is not related with the sternum, and this together forms the superior vena cava. And superior vena cava is also not related with the sternum because it is quite posterior. That's why it is not related with this part. So you have cleared that concept that left brachiocephalic vein is related but right brachiocephalic vein is not related. And the related part are in the lower part arch of aorta, in the upper part left brachiocephalic vein, brachiocephalic trunk, left common carotid artery, and left subclavian artery. Now, borders of the Manubrium. The superior border, first of all, superior border is quite thick. And it has suprascapular notch or jugular notch, and two clavicular notch also present on each side. And the suprasternal notch gives the attachment to investing layer of the deep cervical fascia and interclavicular ligament. So suprasternal notch. So what it does? Suprasternal notch gives some attachment to the investing layer of deep cervical fascia and interclavicular ligament. So what are the attachment? Suprascapular notch got two attachment. One is investing layer of deep cervical fascia and is interclavicular ligament. Now inferior border. It forms the Manubrium-sternal joint. This is Manubrium, this is the body, and this joint is known as Manubrium-sternal joint. And this joint forms a little bit of angulation like projection, and it is known as angle of Lewis or sternal angle. This angle gives articulation on either side with second costal cartilage. And this costal cartilage is half in the body and half in the manubrium. And this we have discussed here. The half is present in manubrium and half is present in body. And in between them, the presence of Manubrium-sternal joint or angle of Lewis or sternal angle. Now comes to the next border, lateral border. Lateral border forms the joint with first costal cartilage, which forms a primary cartilaginous joint. In the first part, there is connection of first rib, okay, and the first costal cartilage is connected with the manubrium with a joint, and this joint is cartilaginous joint. What is this? Cartilaginous, primary cartilaginous joint. And lower part has a demifacet or half facet for the second costal cartilage, which is a plain synovial joint. So we have got a difference between the joints of the costal cartilage. The first one is cartilaginous, and second to seventh, these six joints are synovial. So it is a difference. You can must remember it because it may be asked in your Viva exam that tell the difference between the costal cartilaginous joints with the sternum. So first one only is the cartilaginous, and the second, third, fourth, fifth, and sixth and seventh also is synovial joint. So lateral border has the joints. In the first part, there is in the upper part there is first costal cartilage and primary cartilaginous joint is present, and in the lower part, in the position of sternal angle, there is present of second costal cartilaginous joint, which is synovial joint. So if we summarize that today in this part only, that sternum is a flat bone. It is present in the anterior chest wall, and it is present in the median part of the anterior chest wall, and it is about 7 inches or 17 centimeter long. It is mainly made up of spongy bone, so it is rich in red bone marrow. And sternum is made up of three parts. One is manubrium, one is body, and one is xiphoid process. And the bony features are sternum contains suprasternal notch or jugular notch, clavicular notch, then sternal angle or angle of Lewis, then notch for the first costal cartilage, second, third, fourth, fifth, sixth, and seventh. Then we have come to the manubrium. Manubrium is also known as presternum or episternum. It is a wider in the above and lower than the below. Sorry, it is wider above than the below part. It has two surfaces, one is anterior surface and one is posterior surface. And it has four borders, that is superior border, inferior border, and two lateral borders. In the anterior surface, it gives origin to the on the either side of pectoralis major and sternal head of sternocleidomastoid. In the posterior surface, it forms the anterior boundary of superior mediastinum, and it gives origin to the sternohyoid and the sternothyroid on each side. And each half of the lateral part of the posterior surface of the manubrium is related to the corresponding parietal pleura. And this surface is also related with the vessels, like in the lower part there is presence of archa aorta, and in the upper part left brachiocephalic vein, brachiocephalic trunk, then left common carotid artery and left subclavian artery. And now the borders, the superior border is quite thick. It has suprasternal notch or jugular notch and the clavicular notch on each side. Then the suprasternal notch gives some attachment. We have already discussed that it is giving attachment to the investing layer of deep cervical fascia and the interclavicular ligament. In the inferior border, it forms the manubriosternal joint, and this joint forms little angulation called angle of Lewis or sternal angle. Then this angle gives articulation on either side with the second costal cartilage. Now lateral border. It forms joint with the first costal cartilage, which is a primary cartilaginous joint. So first one is primary cartilaginous joint, and the second to the seventh is plain synovial joint. Now we will discuss about the body part. Body of sternum. Body is the longest part of the sternum. So it is the longest one. And it has two ends, two borders, and two surfaces. If we take this as a sternum, then it has two ends, this one, two borders, this one, and two surfaces, one is anterior and the behind one is posterior. And the body is widest near its lower end. In the lower part, it is quite wider than the upper part. So first of all, the anterior surface. We will discuss first about the surfaces. Anterior surface. Anterior surface shows three ill-defined horizontal ridges. So what are those? These are the ridges. Because if you take this, so it has three ill-defined horizontal ridges. These are the horizontal ridges. Okay. And this line represent the fusion of four small segments called sternibrae. These are known as sternibrae. So this line represent fusion of four small segments called sternibrae. Sternibrae are four present. And these surfaces gives origin to the pectoralis major on the corresponding half. So anterior surface muscular attachment is pectoralis major only. Pectoralis major coming like this. And the horizontal ridges connects the sternibrae. Now posterior surface. The transverse ridges which are present in the anterior surface very prominently, in the posterior surface you cannot find these too much prominent, they are less prominent here. So it help you to determine the surface, which one is anterior and which one is posterior. So first, if you take this as the sternum body, then you can see that here will be the prominent three ridges in the anterior surface, but in the posterior surface there will be not that much prominent ridges. Okay. And the lower part of this surface gives origin to transversus thoracis. Transversus thoracis. And posterior surface is related to lungs, pleura, and pericardium. The manubrium is only related to parietal pleura only just, but in the manubrium it is related only to the parietal pleura, but in case of body it is related to lungs, pleura, and pericardium. Now, how it is related we will discuss then. On the right side of the median plane, the posterior surface is related to the anterior border of the right lung and pleura. So, if you take the sternum again, manubrium, xiphoid, and body. Then, right, left. On the right side first of the median plane, the anterior border of the posterior surface is related to the anterior border of the right lung. Here is present of the lung. So this is the lung, okay. And when you see that, you can only find in the right side there is presence of anterior border of right lung and the pleura. Pleura is the covering of the lungs, and in case of left side of the median plane, you can see that upper two pieces of the body are related to the left lung and pleura. The upper two part is related to left lung plus pleura. But in case of lower two pieces, there are four pieces we have discussed: one, two, three, and four. The lower two pieces are related to the pericardium, because here is the presence of heart and there is cardiac notch present in the lungs. That's why relation to the lungs and the pleura is not present there. There is the relation comes with the heart, and the in heart it is the relation is only with the pericardium. So if you take the body, then there is right side and left side. In the right side there is present of anterior border of right lung, then the pleura, and in case of left part, upper two segments or upper two parts has left lung plus pleura, and the lower two part gives origin to the pericardium. Relation, sorry, not origin. So I think you have understood this. In the right side, there is the relation is with the anterior border of the anterior border of the left lung and the pleura, and in the left side there is left lung plus pleura in the upper two segments.